Great. Hopefully everybody can hear me. So yeah, I want to talk about the power of collaboration. And um, as we've mentioned, AVAC is an advocacy organization that sits in New York, and we work through a series of partnerships to think about stakeholder engagement and really how to optimize that in the research process. And so while I'm going to talk about this idea of collaboration, I'm building on lessons from partners. I'm building on the stories of many of you here, and I hope you can kind of bring that into the chat and into the discussion. Great, so what do we mean by engagement? I wanted to start off with this because a lot of the conversation that I've heard today is such rich discussion, but I think when we say engagement and collaboration, we're sort of thinking about those two words as if they're the same thing. And so I thought I'd start off with talking about what we at AVAC mean by engagement. And here's just sort of a little diagram, which I'm sure all of you think about, which is this idea at the center is these core principles about mutual understanding, respect, integrity, many of the things that have come out in the conversations in the small groups. And sort of the overlying circle is the process of how we go about enacting those things. You know, we identify our stakeholders, we analyze what's going on, the process of engagement. And all of that is to really get to this place where we're building the capacity of our partners, of our stakeholders. We're going from merely this awareness phase, we're informing and consulting, all the way up to collaborating and empowering. And when I talk about collaboration, I'm kind of talking about this space at the upper level where when you are collaborating and empowering, you're really getting into the place where our partners can become advocates for issues. So when we think about this idea of guidelines and competing priorities, I'm just going to talk about the HIV prevention space. And this hopefully will give you a flavor of sort of what's happening potentially at the site level for many of you. Right, just within the HIV space, you have this broad set of international guidelines. You have CIOMS, EDCTP. A lot of our sponsors within the HIV prevention space are thinking about that come from the National Institutes of Health and their varying networks. Then you have different things like pharma, and Janssen has an engagement program, all of which have specific guidelines that talk about how do we engage with our stakeholders, oftentimes thinking, how do we engage with our stakeholders from the trial site out to get feedback on the process? And different, within these are going to be different requirements, different templates for how we operate. The HIV Vaccine Trials Network asks you to put together a community engagement plan, and then you get funding based on that plan, whereas the Microbicides Trials Network is going to be thinking about stakeholder engagement at the site level, giving a stipend, thinking about it from the network perspective on each protocol, coming in and doing stakeholder engagement activities before it actually gets to that site level of engagement. So each one has a different flavor, each one has a different way to operate. And on top of these international guidelines for HIV prevention, you have country-specific guidelines. Here we have South Africa, Uganda, and Thailand. Just again, as some examples, where each one is going to have its own set of guidelines that talk about, that give advice for engaging stakeholders. Then on top of that layer, you have different research organizations have their own guidelines on how they're going to operate a CAB, maybe different standard operating procedures on the way engagement can take place, how communication strategies happen. And so all of these things are happening at the same time. And this is all within the HIV prevention space. And we know that trials don't just focus on one disease area. So you have within that, how do you deal with the different infrastructures of TB, Ebola, now we're seeing COVID research and this idea of emerging pathogens and the tensions that happen there. And Shelley just talked about it so beautifully in this idea that, you know, these tight restrictions, how do you respond to community needs in these tight restrictions? We'll hear sort of just a very brief overview of prevention, HIV prevention. Now, couple that with what TB is bringing in, what these sort of emerging spaces are bringing in, and you can see that there's sort of a lot of a lot happening. So the way AVAC approaches this idea is to think about it from good participatory practice. We're going to hear a lot more about this guidelines on the 4th day. So I'm not going to go into too many of the details, but just this idea that AVAC really thinks about GPP as a consistent global standard for stakeholder engagement across HIV prevention trials, but really beyond that. And again, the adaptations will be talked about on the 4th day. So here within the HIV space, AVAC thinks about GPP as a mechanism to build the capacity of our stakeholders to cut across all of these various processes and think about that as the collaboration. So we think about stakeholder engagement, we utilize a community of practice, again, expanding not just within the HIV prevention space, but how do we manage across multiple disease areas, and widening the audience, not just for how the guidelines can be approached, but thinking about this as a way to govern stakeholder engagement. So AVAC works across 3 Ds, and I bring this in, I know many of you think about a community of practice, but again, this idea of empowering our stakeholders to be advocates to manage this process. So this idea of delivering communities of practice and these regional hubs that support implementers across disease areas. This doesn't just go for how do you manage competing guidelines, but giving people a space to talk about what works, what doesn't, allowing them to have resources that fit in with, again, these regional specificities and requirements, but also giving them, building the capacity to fix some of these issues and elements that are happening, and I'll go into that in the next slide. But then documenting the experience of GPP to support implementers. So we all know that this idea of engagement is not always, it's building its place in the literature, but how do we share, how do we create data-driven models, but then how do we share our stories so that we can talk about the collaborations and the partnerships that work, bringing in not just external partners when we think about engagement to be the gatekeepers of the community or to build support and trust, but also thinking about how do we tell the stories of building our internal collaborations, working with various team members within a research organization, within the policy space, to bring all of them together to sort of streamline how these elements can work. And at AVAC, we have a couple of different ways that we've done that through comprehensive training, through some online courses. One I know that you will hear about again in the coming days, focused on different stakeholder groups, thinking about ethics community, but also thinking about a comprehensive leadership program to think beyond just your own trial site or any specific trial, but think about how your engagement program can impact the health of your communities. And in doing that, how do you collaborate with stakeholders at various levels to break down some of the barriers that can happen? AVAC also has created several tools that can be utilized that cut across a lot of these guidelines, thinking about the different templates and things like that, creating things that focus on the research process and building out your programs based on the life cycle of research rather than any one trial. So providing those tools. This idea of building champions, again, we'll kind of give an example of that in the next space, but this idea of creating people who can talk not just about any particular research project, but about research in general and the process and the need to kind of overcome those barriers. And then I gave one example of a coalition to accelerate and support prevention research that AVAC and many partners have come together, some of which are on the line, to really think about an African-led movement on building comprehensive, not just engagement programs, but comprehensive engagement strategies around research, and thinking about the different actors and players that kind of come in there. And this coalition is designed to think about focusing on how the intersectionality of HIV prevention research and how you navigate that space. And so this idea that you can do this engagement work and build these coalitions, not just sort of north-south, but also within your own national space. And I'll give some examples. So within this space, treatment action literacy campaign in Zambia, it's an advocacy organization, civil society, but through this empowerment and working with research communities who have given the time and investment to empower these external stakeholders, TALC was actually able to do trainings on the importance of stakeholder engagement. In a recent study, they were able to create a monitoring and evaluation system that was separate from the trial site. So they were able to empower the community even further and further improve that message. They were also, because they were a civil society organization, they already had a seat on the National AIDS Council and were able to bring the message of this trial and elevate it up to the policy level so that Zambia could think holistically about what does this mean for HIV prevention? What does this mean for POP-ART, which is a combination study looking at combination prevention? How do we think about this, after the results come out? How do we build infrastructures ahead of time? And so they were able to be a dot connector and break down some of those barriers. The same is true in Thailand, which established a national CAB. That CAB is more than just a community advisory board. They also serve as an advocacy body that can push the varying research organizations funded by various funders to think strategically about what does this research mean in Thailand, and actually have come out with their own set of recommendations for engaging stakeholders. Uganda, not only do they have a requirement for engagement in their research ethics guidelines, but they also have a national CAP that brings together all of the different research organizations where they can talk about best practices and again, begin to break down those barriers of how are we not just engaging our communities, but how are we collaborating with each other to advocate for additional funding, to maybe streamline processes, to push back as a collective voice, so that we have sort of less silos and more interconnectedness. How do we talk about other issues? How do we work across not just the HIV prevention space, but the elements that feed into prevention? And finally, South Africa, the National Stakeholder Forum, which was established in 2016, looks at this exact same way, but at a fully national level, thinking about what are the issues of engagement from a policy perspective, from an actual conduct and implementation perspective, and how can we as implementers think about this role? And all of this has kind of come with this idea that when you truly build the power of engagement, you can collaborate with stakeholders to continue the work outside of the trial site to begin to break down this role. And AVAC has played a role, but certainly is not the one that has done most of the effort. It's really some of the people on this call today and in this meeting. So I'll kind of end there with this idea of how do you break down collaboration, and just maybe leave with a question. This is my contact information, and our community of practice and the courses can be found on this site, Engage, for those who are interested. But maybe I'll just leave with this question, which is how do others navigate these layers of guidance, especially when some have competing values?